A warm good afternoon to one and all. Hope you are all doing good. I am K.S. Ramya, HOD of Psychiatry, working as an associate professor. This will be a lecture of childhood disorders. I will be presenting to cover the following topics: introduction, definition, clinical features, epidemiology, etiology, management of ADHD. So as you can see in this picture, the teacher is taking class but the student was unable to concentrate in the class. So this is called as inattention. So today we are going to discuss about attention deficit hyperactivity disorder. So this is one of the most common mental disorders that is affecting children. Next, moving on to the introduction of ADHD. So ADHD stands for attention deficit hyperactivity disorder. So in the psychiatry we are having two main classification. One is DSM-5 and the next one is ICD-10 classification. In the DSM-5 it is diagnosed as ADHD, whereas ICD-10 it was diagnosed as hyperkinetic disorder. So this syndrome was first described by Henrik in the year 1854. Next we'll see the definition of ADHD. So these children always they will be having the inattention. Inattention means unable to pay concentration and attention. For example, if the teacher is taking class, the student were unable to listen the class. Hyperactivity means always moving from one place to another place. According to DSM-5, this disorder was diagnosed as neurodevelopmental disorders. And next, moving on to the clinical features of ADHD. The main clinical features of ADHD are inattention, hyperactivity, impulsivity. So these symptoms we can identify at school and at home as well. These symptoms will be present in the children for at least 6 months, and it is mainly affecting social behavior, and the other one is academic performance. Social behavior, for example, they were unable to communicate with other children. So if they were not communicating, they cannot maintain friendship with other children, and they cannot able to play with other children due to inattention. And the other one is academic performance. They cannot get good marks in the examination. So these are all coming under academic performance. Next, moving on to the epidemiology. 1.7% of primary school children were diagnosed as ADHD, and this ADHD was commonly seen in boys than in girls, that is 4 times. And coming to the ICD-10 classification, less than 7-year people are affecting with this ADHD, and according to DSM-5 that is 12 years. And according to DSM-5 ADHD was 4%, and according to the ICD-10 the children was affected with hyperkinetic disorder was 2%. And this disorder was commonly seen in lower socioeconomic classes and the children who brought up in institute. Next one is inattention in ADHD. It is mainly manifested by unable to maintain concentration. So they cannot able to maintain concentration until they complete the task. For example, if you are giving any task, like for example completion of homework, they cannot able to complete because of inattention, and they were easily distracted. Distraction means deviated from attention, and they will not listen to others, and they cannot able to follow the instructions of school teacher or parents, and sometimes they will forget their daily activities, for example brushing, bathing, all these things. And sometimes they were having the difficulty in organizing activities, and even often they will forget books, pencils at home, and they'll go to the school, as you can see in this picture. And sometimes when they are playing, after playing, they will misplaces the toys. So these are all the symptoms we'll see in the ADHD people, and they cannot able to complete the homework. Next, hyperactivity in ADHD. It is mainly manifested by excessive motor activity. So they cannot able to sit in one place. They always moving from one place to another place. And next one is fidgets with hands and legs. That means they will move their hands and legs. And next one is scrimps in seat, shifting the body from one place to another place, or one side to another side. And they want to leave the classroom, and all children are sitting and listening the lecture, but the children who is having ADHD, they want to go out of the class. And feeling restlessness, because of excessive motor activity, they will feel restless. Especially these symptoms were seen in older children, and they will make more noise. These children will be having the on the go, means they want to go out of the class. Next, third symptom is impulsivity in ADHD. It is mainly characterized by, without thinking, they will do the actions, then they will talk excessively. Before completion of a question, they will try to give answer. And as you can see in this picture, all children are standing in a queue, and the children who is having the ADHD, they cannot able to stand in a queue. And the other example is, if the student is playing any basketball, if the in that group, if the children is having ADHD, they cannot wait until their turn comes, and they will always try to disturb other. For example, if in a group, if the children all are having a conversation, they will try to disturb in between. Next, moving on to the etiology. uh, Actually, the exact cause of ADHD was unknown, and there are some contributory factors. First one is genetics. In the family, if anybody is having ADHD, for example, if the father is having ADHD, then the baby or the children will be affected with this ADHD. And next one is excessive dysfunction or frontostriatal dysfunction. That means if there is an abnormal regions in the frontal brain regions, it is also affecting this ADHD. And monoamino dysfunction, if there is an abnormal transmission of neurochemicals such as dopamine, serotonin levels, and non-adrenal levels, it also leads to ADHD. And the people who are having the ADHD, they will be having the decreased brain volume. That brain volume will see in both white matter and gray matter. If you are taking neuroimaging, so we'll be having the decreased brain volume in both white and gray matter. And if you are taking the EEG, we'll see the low waves, increased in slow waves of EEG. Next, this ADHD is more commonly seen in low birth weight babies. That is the children who is weighing 1.5 kg, and the mother who is having the habit of smoking during the time of pregnancy, and the baby who is having the habit of taking food coloring agents like cool drinks and fast food. And next one is intoxication. Lead is one of the most dangerous environmental pollutants. So this lead is mostly present in contaminated food, contaminated water, dust, soil, and it is also present in toys. If the with these contaminated toys, if the child is playing, it also leads to uh, ADHD. And lead is also present in cosmetics. So because of this lead, 60 to 80% people are considered as ADHD. Okay, 60 to 80% people are having this ADHD. So if they are having the lead intoxication, it is also affecting kidney, nervous system, and increases the high blood pressure. So it is associated with ADHD. Lead is associated with ADHD. Next one is infections such as encephalitis. So encephalitis means it is an inflammation of the brain tissues. So it is mainly of two types, primary encephalitis and secondary encephalitis. Primary encephalitis means the virus will directly enter into the brain and spinal cord, and the secondary encephalitis means it is affecting any part of the body and then entering into the brain. So what are the symptoms of encephalitis? Confusion, drowsiness, hallucinations, coma, seizures, and irritation. These are all the symptoms. So there is a relation between ADHD and encephalitis. Next, moving on to the management of ADHD. So in order to rule out the ADHD children, we have to do the thorough assessment. That is, we have to collect the family history, because in the family, if anyone is having ADHD, it is going to affect their children. And the next one is academic performance. We have to observe the academic performance, so we have to collect history from school teacher. And next one is we have to see the social skills, like for example, how they are communicating, whether they are communicating with other children or not, whether they are playing with other children or not, we have to observe. And next we have to educate the children, parents, carers, teachers as well. And we should not blame the behavior of a children. Instead of blaming a children, we have to mold the children. And next we have to give some training programs for the parents, that is balanced diet. We have to give proper diet for the development of the brain. And next one is regular exercise. If the children is doing regular exercise, so I already told you the neurochemicals in the brain will be maintained normal. And food coloring agents we should avoid for the children. And if possible, we should take the advice of dietitian also. And we are having this ADHD three types: mild, moderate, and severe. If the ADHD is mild to moderate, then we have to give the behavioral therapy, individual therapy, and group therapy. If it is a severe ADHD, then what we have to do, we have to give therapies and then medications. Okay, if they are not responding to therapies, automatically we have to give the medication. And social skill training also we have to go. Social skill training means we have to uh, educate the children how to communicate, how to play with other children, how to maintain relationship with other children. So everything we have to teach. And next, moving on to the management of ADHD. It is of two types. First one is CNS stimulant drug and the other one is non-stimulant drug. So in the stimulant drug, CNS stimulant drug, we are having two main drugs, methylphenidate, and the other one is amphetamines. And non-stimulant drugs, first one is atomoxetine. So these drugs we can give orally, and methylphenidate, it will be available in two forms. One is tablet and the other one is patch form. So this patch form we can directly patch to our skin. Next, mechanism of action. The exact mechanism of action is unknown, but the theories have explained this mechanism. Methylphenidate, it is a CNS stimulant and it inhibits the dopamine and blocks the dopamine transporter. So if we are blocking this dopamine transporter, it decreases the hyperactivity and inattention. And if we are increasing dopamine and non-adrenal levels, so that the brain will maintain the normal neurochemicals in the brain, and which gives motivation for the children. And atomoxetine, it is considered as a CNS stimulant. It mainly blocks the norepinephrine and increases the non-epinephrine. It blocks the non-epinephrine transport and increases the norepinephrine levels. Next, moving on to the side effects of methylphenidate. So the main side effects are headache, reduced appetite. The patient will not feel hungry. So we have to check the weight of the children. And next, insomnia, lack of sleep. Fourth one is increased blood pressure and pulse rate. So we have to regularly check the pulse rate and blood pressure. And if you are giving this drug in high doses, then the child will develop the symptoms like psychosis, tics and seizures. So if we are taking this methylphenidate as a patch, that means we are attaching directly this skin. uh, what are the side effects? Are the side effects are skin pigmentation. As you can see in this picture, we are having the skin pigmentation, that is called as chemical leukoderma. And next, the side effects of atomoxetine. So these side effects are same like methylphenidate, but not that much severe. And the children who are taking this atomoxetine, it is the main side effect is suicidal tendency. They are having the suicidal thoughts. And ADHD. So why ADHD is called a syndrome? Because ADHD, if the person is having the ADHD, it also leads to Tourette syndrome. Tourette syndrome means it is a abnormal uh, movement disorder like tics. So if the person is having the Tourette syndrome, so we have to give the atomoxetine drug. And both atomoxetine and methylphenidate, if the person is taking, so what will be happening is preapsium. It leads to preapsium. Preapsium is a disorder which is seen in the male. So in this, what will happen is they will be having the painful penis erection. Because of this painful penile erection, so it leads to permanent permanent damage in the penis. And next, long term courses of ADHD. So symptoms will be increasing. So this ADHD will be seen in childhood, and it will be lasting up to adulthood also sometimes. So the symptoms will be increasing. And the children who is having the ADHD, it leads to affect in the educational achievements. They cannot able to achieve their academic performance. And if they are not having the proper education, they are having the difficulty in doing their job. And if we are not treating ADHD, the result will be very poor, like as I told, educational, school failure. Next one is peer rejection. So these are all will be coming under poor outcome. And if we are untreated, so what will be if we are untreated, it also causes other disorders. So that's why we have to treat. So we have to give medication and psychosocial skill as well. So if the children is having the ADHD, it also leads to conduct disorder. And it also leads to substance abuse disorder. As you can see in this picture, substance abuse disorder like alcohol, taking of alcohol, taking of cocaine, taking of barbiturates, taking of cannabis. So these are all coming under substance abuse. And antisocial behavior. Antisocial behavior means they will not follow the rules and regulations in the society. For example, they will develop the criminal behavior. Okay. And they will do the rash driving, which leads to accidents. So these are all coming under antisocial personality disorder. So this ADHD symptoms will be lasting for up to childhood to adulthood. Thank you for watching. Hope you all understood my lecture. Thank you.